Harm reduction. You've probably been hearing those two words a whole lot lately, specifically in relation to thousands of overdose deaths across the country. But what exactly is harm reduction?
This is to reduce the risk associated with activities that you're going to be doing anyway. For instance, a non-opioid example of harm reduction might include wearing a nicotine patch as you try to reduce your smoking.
Health professionals say the goal is to reduce harm for people using drugs. Harm reduction includes things like naloxone to reverse the effects of overdose, or handing out things like clean needles to prevent the spread of HIV and hepatitis.
When we don't focus on the drug use per se and focus on all these other things that are happening in people's lives, that's where the supports are going to have a greater impact.
Supervised consumption sites are a tool in harm reduction. They're a place people can go to use drugs under supervision by somebody who knows what to do if an overdose happens.
When people do not have access to housing, they do not have access to do this behind closed doors. So then they are doing it in public. Whereas if we had an OPS, that is somewhere that they may be able to go and feel safer. That is the goal.
It also allows users to test their drugs for dangerous and deadly substances like fentanyl. Staff can include nurses, social workers, and mental health professionals.
Some people are under, the understanding that it's about promoting drugs, but what it is about promoting health among people who use substances, because, they deserve health too.
Discussions around supervised consumption sites can be controversial, but advocates say it would help save money in healthcare spending and make the community as a whole safer.
Also, with the discarded syringes and discarded safer consumption materials in public, having a site that is central that folks can come to and consume substances without retributions would allow folks to discard those on site and also encourage those pathways to care.
There's a lot of evidence here in Canada and all over the world that harm reduction works.
We talk about really the importance of three things: prevention, treatment, and harm reduction. So you can't have one on its own. It's really important to have all three. So it's not an either or.
What we tend to see is people's drug use tends to get better when we start attending to things like their housing, their employment, their trauma counseling.
And advocates say it's an essential service. One example is the Ally Center in Cape Breton, which opened just over a year ago.
Well, we had to expand our hours and we had to add another booth because we were so busy and people were kind of waiting too long, we thought, to get into the site.
Now, P.E.I.'s government has said it's committed to establishing a supervised consumption site, but there has been no updates on that since last fall. That's when Charlottetown City Council voted against a plan to put that service near Park Street Emergency Shelter.
All those in favor of the rejection, please put up your hand. In favor of the rejection.
Advocates say having a site here on the island is more urgent than ever.
It is a need that we've been hearing about from participants since 2019. The need for that service has only increased over time. We've seen the complexity of overdoses happening in communities shift. Things are certainly more complex. The substances that are around, like I said, are more toxic.
There were 14 accidental opioid-related overdoses between January and June of 2023. The province says 2 of those people died. Numbers for the second half of 2023 have not been released yet. And those who deliver harm reduction services say they just don't want to see anyone else die. Tony Davis, CBC News, Charlottetown.